It's been 1 week since the first of 2 confirmed cases of measles were reported in the Upper Peninsula. Since then, 1 other person was reported to have contracted the virus, and a list of potential exposure sites has grown. The Marquette County Health Department is asking anyone who was at any of them within a 2-hour window of the potential exposure to call them. Now let's briefly go over where and when those may have been. In Marquette, that's anyone who is at Moon Spun Wool at any time on May 19th, 20th, or 21st. The First Bank on Washington Street during business hours from the 20th to the 23rd. The Marquette Food Co-op anytime on the evening of May 20th, or the Midas on US 41 on May 21st between noon and 2 p.m. Also included is the Marquette Meijer on May 23rd from 5 to 9 p.m. Anyone at the UPHS Portage Express Care between about 11 a.m. and 1 p.m. on May 26th. And on May 27th, the emergency room at Aspirus in Ironwood between 11 a.m. and 1 p.m. as well. Now, measles can cause a fever, cough, rash, and other flu-like symptoms. Vaccines are about 97% effective, but unvaccinated people have a 90% chance of contracting the virus if exposed. Since it takes about 10 to 14 days to develop symptoms, experts at the health department say it's important to reach out to them regardless of whether you think you have it. These cases in Marquette are a part of a nationwide surge of the virus. This week, we've been speaking with medical experts about how concerned you should be and what they think you should know. MyUP's Skylar Perkins has the story.
Back on Wednesday, we worked to bring you some perspective to concerns over the intense wildfire smoke we saw at the start of the week. And one expert advised us it wasn't much of a big deal for the general public. That was emergency room doctor David Grant. And as for what he would advise more people to take action on, he said he'd
encourage them to quit smoking, get their measles vaccine.
His comments come just shy of a week since 2 measles cases were confirmed in the Upper Peninsula. According to the latest data from the CDC, 3 people have died of the 1,000 or so who have contracted the virus this year, which is also the same number of people who have died of the virus in the last 20 years put together. Looking at the latest numbers, over 1 in 10 people in the U.S. who have caught measles this year have been hospitalized, and in children under 5, that number doubles. Dr. Grant described for us what that situation would look like in our community.
It's probably a parent bringing a child and they're nervous, they're worried the child may look like any respiratory virus. They may be ushered back to their vehicle if we're full until we have a negative pressure room available, and then family who aren't vaccinated wouldn't be allowed back with them.
He said the COVID-19 pandemic has prepared staff for dealing with contagious respiratory viruses, but also told us the hospital has its limits.
If someone got sick enough and they were pediatric, we're not a pediatric ICU center, we would have to move them to a bigger hospital. But for most people, hopefully that won't happen.
While not always deadly, the virus can have lingering effects that weaken your immune system to other viruses. According to the health department, about 85% of people in Marquette County have the MMR vaccine, which is about 10% less than what's needed for herd immunity. That means unvaccinated people and people who can't get the vaccine, like newborns, are all the more at risk. But the rise in cases is running alongside a rise in vaccine skepticism.
I just wish people got vaccinated and we wouldn't be having such a discussion.
From there, we sought out Dr. Isaac Smith, a Marquette area pediatrician who said he's seen that rise firsthand and often talks with parents about their concerns over inoculating their children. Tune back in Friday for an inside look at how those conversations go. For now, in Marquette, I'm Skylar Perkins for MyUP News.